Yes, and it's on the TV too, so you'll be able to see it.
Cool.
Let me get a good window here first.
I guess I was just
That's so helpful. I wish I could do that. Like take pictures and then write really
I think that's good enough. All right, put you into number 1.
Oh, are we supposed to have a piece of paper?
No, he's just answering.
Use TV, put on the table, whatever you. You want a little table to put your stuff on?
Is that the question? Did he ask me?
Yeah.
Okay.
What's that?
What's what? Oh, sorry, there's an arrow. I was like,
Did he ask the question or not?
So, or did we say which
I
sign?
mean, I'm only really operating that one, but I'm just looking over the
I mean, can we rotate it around or like
take pictures and label them 1, 2, 3.
like the superior
We're
side?
not high enough. I don't
That's
You should be able
So we're like
to
at the level of the
you
eyes.
can kind of figure out which one you wanted to see.
So
Because yeah,
we're
straight
at
sinus
we're
is
at
a
eye
good.
level. Yeah. Straight sinus?
I think so.
I think so. Especially since it's. I mean, I could be.
I thought straight sinus is a little deeper than that.
What do you mean deeper?
Like toward the, if you can
Like
zoom in,
inferior?
yeah, inferior a little bit more.
I don't think we can.
Well, we're at orbit.
Well, look at-
level,
see, look
so
at this.
That's pretty low down in the brain.
Right.
Like that also shows you.
So superior would be way at the top, and
And then a.
inferior sagittal is just still above.
So are these your lateral?
Seems like
Okay.
a good.
Yeah, yeah.
I think it's the end of like this was like bottom part of the posterior one.
Okay.
You think it's what?
Those I think are the ends of the lateral,
Okay,
I
yeah.
think so too.
like the posterior, like the bottom, like you know how the horns kind of.
Straight
Oh yeah,
sinus.
the bottom of the horn. Okay. So yeah, straight sinus.
I think so.
In the morning?
And then coming
Alright,
off
so,
of
as
that,
you
brain
discussed-
cerebral vein, right?
I'll ask you some questions.
I wish you were gonna get it turned in. Yeah.
So, is this with black being most radiolucent and white being most radiopaque? So CT, no contrast. So it's essentially a 3-dimensional X-ray is what a CT is, right? So with those, being your set points, is that thing that it's pointing to, is it more radiolucent or more radiopaque compared to the tissue around it? It's more radiopaque, right? Compared to all the rest of this tissue, right? So all the rest of that tissue, for all intents and purposes right now, we're going to call it brain, right? So right? If it's brain tissue, then it's probably going to be the same density, which means it's probably going to be the same color. Okay? So if it's not brain tissue, then it's probably a different color because it's going to have different density. Right? So that tells you this is probably not brain tissue. Right? Now, if it's not brain tissue, what else do you have in your cranium? Well, you got some different kinds of fluids. You got some CSF, and you got some blood. Right? So should we see like areas that are completely radiolucent? As in like, this is radiolucent, so what does that mean? This is
Air, nothing.
So we got air in our head? Well,
No,
I mean, that
well-
depends, but probably not. Right? So,
Yeah.
I don't think there's any type of pneumocranium, right? So, yeah, so in other words, like that's essentially we're looking at kind of a gray scale with, darker, more radiolucent being one type of fluid. We've got brain tissue kind of in the middle, and then we're going to have more radio opacity, which is probably going to be another type of fluid. So, as you compare this to the black area out there, is it more radiolucent or more radiopaque than those areas that appear kind of black? More radiopaque. Okay? So, which one, this arrow or that radiolucent area, which one of these is going to represent which fluid? In other words, what is, so one of the fluids that could be in our brain is what?
CSF.
So how are you going to tell if it's CSF? What is CSF made out of? Yeah, water basically, right? So water, yes, proteins for that, but water, right? Right? It's not really cellular. What about blood?
Sure.
Sure, it's cellular, right? So it's going to be more radiopaque because it's denser. Right? So which one of these is blood? The arrow or the black area out there? Which one's blood? The arrow, right? Because it's more radiopaque, right? So for the most part, when you're looking at the brain, even though technically there's 256 shades of gray, right? I mean, you thought there was only 50, but there's definitely 250 some odd shades of gray. That if it's rather black, you can probably assume that it's CSF, right? If it's more radiopaque than the quote-unquote brain, it's probably blood. Right, so that kind of gives you an idea. So then you just have to orient yourself as to where you are, right? So based off that, we know that this is probably blood. Now, where are you, right? So where you at, right? Now, I will tell you that you'll have images like this on the practical. They'll probably be still images. When I do that, I will crop this. You aren't going to have the little yellow cheater guy down here, okay? So, right? So you have to understand where you're at. Oh my God. So where are you?
So you've got
You got orbits, yeah, great, right? Find your orbits, right?
Yeah.
You have to orient yourself left, right, anterior, posterior, right? Anterior's over here. I got orbit. Now, what part of the orbit am I at? Look at the nose. Where does it look like? Do I see a lot of nose?
Yeah.
Well, do you see a lot of nose? You see nose, you see bony looking stuff, but if I was to scroll down, what would happen to the appearance of the nose? I know it's anonymized, but we'd see more of it, right? So that means I don't see all of nose out here, right? So I've got to be up here somewhere. I see a little bit of nose, but not a whole lot, right? In fact, I can see that this is probably ethmoid where the air cells are. So it kind of gives me an idea. I'm like at the roof of the nasal cavity. I got some orbital cavity there. All right, so I kind of got an idea. Now, if I'm at this level, right, am I at a level where I would find like more cranial stuff? Sorry, more cerebral or more cerebellar? Cerebral, right? Because cerebellum is the one that's that lower one. It does have two hemispheres, but it's down here, right?
Right.
So it's kind of
lower.
giving an idea. One of the ways you can always kind of identify where you're at is in terms of cranium or cerebellar is looking for the petrous ridge, right? Because this cerebellum sits within that posterior cranial fossa. Petrous ridge makes up that border. So if you don't see petrous ridge, you don't have posterior cranial fossa, so you ain't got cerebellum, right? So we've got cerebrum here. Okay, so I'm in the cerebrum. I've got blood in the midline, right, of my brain, so to speak. So what blood do you have in the midline of the brain?
The great cerebral.
You got great cerebral veins,
Great cerebral.
right?
Chorioplexus.
What?
The chorioplexus. Well, the
No.
chorioplexus is producing, CSF, but right,
Yeah, I see
right
what you're
around
saying.
it. Yeah.
It's you would see some chorioplexus inside ventricles, yeah, but that's not blood. That's producing CSF.
CSF,
right?
It'd be darker.
Yeah. So you've got great cerebral veins in the midline. What else do you have in the midline?
Straight sinus.
Straight sinus, inferior sagittal sinus, right? So these are all things that we would expect to find kind of in the middle somewhere, right? So how are you going to tell what's what? Right? Well, what's the orientation? How does the inferior sagittal sinus run its course? Kind of doming, right? You're at the middle. So now look at what you've got. You've got what type of a plane is this? Axial plane, right? Right through the brain here. And so if I have an object that's running like this, and I take an axial cut through it, am I going to see the whole thing?
No.
No, I'd only see maybe a ball here and a ball here if I've run through both of them, right? If I've run obliquely like this, then I might only see one little thing, right? Depends on my orientation, right? So It could potentially be like sagittal, inferior sagittal sinus, but if it was, right, we don't see anything up here. So what does that tell you? Where in the inferior sagittal sinus you are?
Below
The
it.
very very caudal portion of that inferior sagittal sinus. So I would accept that as an answer, like caudal inferior sagittal sinus. Right? That would make sense because that's kind of where you are. Right? What else could it be? Right, what about great cerebral veins? Right? Now, problem with great cerebral veins is how many do you have? Main divisions. There's two main divisions that are coming into this area, right, along with the inferior sagittal sinus to form the straight sinus, right? So since I only see one little blob, I don't really see like other veins coming in. It's probably not by itself at least great cerebral veins, right? Plus name veins, that's plural, right? So this is only one object. So you could also say maybe straight sinus, right? So straight sinus, right? It does kind of run from, there at the caudal portion of the inferior sagittal down to the confluence, right? Now, it runs obliquely through the head like this. So if I'm taking a cut, right, through it here, right, would I see like a line going all the way down like this?
No.
No, because it depends on how thick my slice is, but probably not, right? And so probably not going to see like a whole line, but you can see kind of a faint line going all the way down. So does that mean that this is not straight sinus? No, it doesn't, right? What does that mean that we're looking at? Assuming this is let's assume this was the straight sinus. Then how is it that if it's running at an angle and I should only see like one little part of it, like one little blob, then what is this that I'm seeing that's down that midline? What makes the straight sinus, right?
The
falx cerebri, right? And tentorium
Tentorium.
cerebelli. So what am I seeing? I'm seeing the falx cerebri.
Yep.
So that's not what the arrow is, but that's what this line is. Right? That line is the falx cerebri, right, that I'm seeing that's forming part of that straight sinus. Right? So I would accept it in this case, like I think it probably is like the caudal portion or the beginning of the straight sinus, right, based off where we're at. And which is, you could also say like the confluence of the inferior sagittal sinus and the great cerebral veins, because that's what's happening. They're all coming together, forms a straight sinus, and down it goes, right? So, if I was pointing to, oh man, it did it again.
Oh, hold on one second.
No, I don't know if it's that. Oh, it is that. Okay, good.
Sorry
It's just you screwing things up. All right. So, if I pointed to that, then that one's a little hard. Now think about it. If this is the very beginning of the straight sinus, right, and I have an axial plane, right, then back here in the back, I'm at the same level as the beginning of the straight sinus, which is up here. Straight sinus does what? Runs down diagonally. So, and it runs down diagonally into the confluence. So if I have a plane that's running this way, can it be confluence? No. But it could be a little portion of the superior sagittal that I'm seeing running down through there. That's the superior sagittal sinus. And so then if I pointed to this, that line in between, which now, because of my windowing, you can't hardly see it, but you can see a little bit better up there. But you can see that that line would then be what? The falx cerebelli. Sorry, falx cerebri. Falx cerebri. All right? Cool.
Yes,
What's that?
that's the false rewrite.
What was the second one that you pointed to?
Superior sagittal sinus. And then the third one was falx cerebri. Yeah.
Straight tracks. No, just this.
So we're a little bit lower now, right?
Pointed to
So the two was just what, the falx cerebri?
So that part-
No, the second line that he pointed to is superior sagittal sinus. And then third is falx cerebri. Did he go lower now, right? He went lower?
No, this is the new.
No, he went.
Arrow.
Yeah, it's
Yeah,
on the head.
okay.
Well, it's. Is it
He's not gonna have this, so we shouldn't train at that.
Too, but I don't
Well,
think
so we're
it's,
below the lateral ventricles, so could it be the third?
isn't that more in the center?
Yeah,
It could be that.
but I can't think of what.
Yeah, I don't know what else.
Well, this could be, couldn't be also the blood flow. I mean, it's not black, but the blood flow is brighter. Like, 'cause this is where that superior sagittal sinus
Technically, the
is.
first time it's made.
I think this is the lower horn of the lateral ventricle.
It's gonna go into.
That's what I think.
Why?
I think we're too low.
Because
All right. So what's that
why
one?
is that? Because the darker color is
Yeah, it's
CSF.
CSF. I don't know. Where
All
are
right.
we?
So you're saying it's
So
CSF
here's
because
the
it's
nose
dark.
coming out.
You said dark is CSF, right? So it's got to be CSF,
So
right?
we're lower.
Now you see one little blob of CSF right there. All right. Now, what areas should have CSF in them?
Ventricles.
What else?
Subarachnoid.
Subarachnoid space. Okay, so maybe this is a ventricle, right? So the problem is that if you were describing this, this is this medial or lateral? Lateral. It seems like appears kind of more, a little bit more lateral, right? But and we do have lateral ventricles, but lateral ventricles aren't shaped like this. Lateral ventricles are these big things that you can see, right? You can always see those big lateral ventricles, right? So what is something that's a little bit smaller like this that maybe would also have CSF in it? That's ventricular. Lateral go into third, right? All right. Well, okay. What's the problem with thinking about this as the third?
Third is medial, right?
Third should be down the midline, right? And I'm not. This is not radiology, so we're not. I'm not asking you pathology right now. I'm just going to test you on normal. So, could there be a big subdural hematoma that's shifted the midline? Sure, but you see it.
Yeah.
Brain tumor? Yeah, sure, but it's going to look different, right? So this is normal, which means that the third ventricle should be in the midline. This is not. So it can't be third ventricle, right? So that means that if you look based on where you are, up here in the orbit, so this has to be lateral ventricles. It's just that you just happen to see just a tiny little bit of lateral ventricles.
Thanks, man.
If you want to be specific, you'd probably call this what?
Posterior horn.
Yeah, the posterior horn, the
horn.
right lateral ventricle, right? Or left lateral ventricle, sorry.
Is it because the head's crooked too?
So, yeah, why? But I thought there were supposed to be two of these, so why do you not have two of these? Well, you can tell by looking at your little guide that his head is a little bit tilted. Right? Could be that. It also could be the fact that not everybody has posterior horns, right? Maybe you only have it on one side, not the other, right? So it could just be an anatomic variant, right? All right, cool. What about? Oh, you're not letting me select that.
I'm not.
Sure, you're not.
Maybe I have a magnetic field.
It's that pen, man. It's that
I know,
pen
man.
that doesn't work on the table.
No, it's
I'm just very smart. That's why
You
it's
froze earlier. I don't know why. So you're still letting me do that. I don't know why it's doing that. All right, what about
Like to sell on eBay.
since I can't? It's not even letting me select it to annotate again. Let's do this.
We all start talking.
Life.
Is that?
I can see it from here. Beep, beep, beep. I'm gonna ruin this one. Oh, it's the other way around.
Yes?
Excuse me? Excuse me. Excuse me.
What we got?
It's you're out of the ears, aren't you? Yeah, you can see the ear. Something to do with the ear.
Is that that one that goes after the third ventricle? That hole that goes after the third ventricle? You know what I'm talking about? That goes back out.
So think
Yeah.
about where you are. Got to orient yourself, right? So if you look,
Goes down to.
I'm pointing to like that little hole there, right? So it's a hole, but in what? You know what this is? Bone, yes, but
Yeah.
what bone?
That's the ear.
That's the sphenoid bone, right?
Yeah.
This is the sphenoid bone. What is this? Right? Well, look at what we have here. What is that?
Ear.
That's the auricle, the ear, right? So I'm in the area where I would expect, right, like the bony labyrinth for the inner and middle ear to be found, right? And so I'm in that area. This is actually a little bit below that, but this area is where like the mastoid air cells are found, right? So that's kind of the area mass. But the point is that we know when looking at the base of the inside base of the skull that there's this area here called what? All this like rocky ridge. It's the
Petrous.
petrous ridge or the petrous portion, whatever. Okay, so we got this petrous portion. Now that reminds me that you've got petrous here, and that's going to separate my into like 3 different fosses, right? So back here, where that hole is found, is going to be my posterior cranial fossa, right? Now, anytime you got a hole in a bone, what's going through it? I don't care what bone
Neurons
you're
or
talking
vessels.
about, right? Neurovascular. All right, so nerve or blood vessel or both. Okay? So, posterior cranial fossa, petrous ridge. All right, so you kind of orient yourself, you kind of know where you're at. Okay? So, all right, cranial nerves. 1, 2, 3, 4, 5, 6. No, none of those go through there. Right?
No.
Oh, what about 7? Maybe, right? So you have 7, right? And 8 run together,
Yeah.
right? 9. Well, 9, 10, 11 all run through the jugular, which is going to be back here somewhere, so possibly, right? And then hypoglossal, right? So 12, which 12 is this area here. Now 12 we know is right at what? The foramen magnum, so they'll see that it's probably not that far down, right? It's not 12. Okay, so I'm in the petrous ridge, posterior side of the petrous ridge. From medial to lateral, I've got this hole, right? Running through the petrous ridge. So who is it? The internal customata. Right? So the internal customata, because we understand that the petrous ridge is here, and so if this area is where like the cochlea, and I'm getting my vestibular cochlear nerve, 8, right? Which is what? How do we classify that as? Special sensory afferents, right? So special sensory afferent 8 running out, all right? It's an afferent running to the brainstem, and what? What else runs with it? Facial, which the facial is what?
7.
Motor, right? So it does have both. It's mixed, right? It has both special sensory and motor. But typically, we would classify this as like what is it going to be? General or visceral?
General, right?
Yeah.
This one be organ.
Yeah. So is it general or visceral, sensory, or motor? Well, it's kind of got both, right? It's kind of that mixed thing. So I would probably still classify this as because it does have both afferent and efferent components, but we would, it'd be okay to classify 7 as, you had to pick one, as like a, motor efferent, right? It does have special sensory afferents in it as well. So it's a mixed bag, right? So 7 and 8 would run through here, right? So that kind of makes sense because this is right where we expect like the cochlea and stuff to be. So 8 would be going this way. 7, I'm out here at the brainstem where 7 would be coming out. And it's going to have like the chordae tympani branch. It's going to have my otic and pterygopalatine ganglia. So you're going to get things like lacrimation and then some mandibular glands coming in. So all that's kind of happening in that internal acoustic natus, right?
On the practical, would you be like name the structure and tell me
I would probably say, so I could do a couple of things, and a lot of times I'll have like a still image and it may have 2 or 3 questions on it. So I'd have like an arrow, and with these types of still image, I'll screenshot it and put it like in a PowerPoint, and then manipulate the image and save it as a JPEG, because I can change the color of the arrows and I can annotate it a lot easier on the computer. So anyways, I'm just letting you know, this would probably be like an image that you would see just cycling on its own up there on the screen, okay? So you'd have like a big red arrow, and I would say like, what is this osseous structure? Because technically it's an osseous structure, it's a foramen, so you'd say internal acoustic meatus, right? And then I might ask a second question that says, identify, identify a object that runs through here, or whatever. Okay. Let's see here. Right. What do you guys do?
That looks like the optic canal, probably. Optic, right?
No.
Why not?
That should be up higher. That.
Wait, we're at the
It's like
mandible
that
now?
dorsoscella area. Or dorsellus. You know what I'm saying? It's all to the side.
So you can still see the ears, right?
Mm-hmm.
So somewhere it's
That's like I think that's the base of the frame. Or no, it's right now. Mastoid. Oh,
Is
so mastoid up.
I don't think so. It's got to be
So,
something with
think about where you're
eyes.
at. Let me see. Where are we at? I mean, you can see, what do we see here? Like, what is, we got some bone in here, right? Any kind of clue what's going on there? It's like a hole inside of your head, like where your skin and stuff is. So that's probably what your external acoustic meatus. So that's a bit of a clue where you're at, right? We also have things like, palate, right? Is that mandible or maxilla?
Maxilla.
Right? So I'm kind of figuring out where I'm at. I'm kind of in this area right here. Okay. All right. Cool. So does that make this tissue back in here? Is this going to be cerebellar or cranial or cerebri?
Cerebellum.
All right. Very good. All right. So kind of idea where I'm at, all right? And so I'm basically on the inferior medial portion of like the petrous ridge, all right? Posterior cranial fossa. So is what I'm pointing at, is that the same color as this? No, all right, it's a little bit more radiopaque, so it can't be this, right? And plus, I know that I mean, the only neural tissue I have running through a hole is going to be a cranial nerve, right? And so I'm probably not going to be able to see a cranial nerve on a CT, right? So probably not necessarily the same tissue as this, right? Is it CSF? No, right? So probably not CSF. So anytime you got a hole in a bone, is that a hole in a bone?
Yeah.
Sure, you got a hole in a bone, what's going to be running through that? Nerve or blood vessel, or both, right? So, right, we know it's not going to be, 1 through 6 in terms of cranial nerves, because that's all ahead of this. Maybe a 7 or 8, but no, we already looked at 7 and 8. We kind of found out where that is, right? Plus, I'm way further down than that. So why not maybe it's, cranial nerves 9, 10, 11, or 12 hypoglossal. Not 12 because we don't see foramen magnum. So I'm kind of above that. So what are we looking at? Well, like I said, you're probably not going to see cranial nerves on here. So it's a little bit more radiopaque than this tissue. Right? So what is it? If it's a hole in a bone, a nerve or blood vessel, I'm not going to be able to see nerves on here, so
It's blood vessel.
blood vessel. So,
Yeah.
all right, I got base of the skull. Right? What blood vessels do I have that are, have a relationship with the base of the skull?
Internal.
And
Carotid. Jugular.
vertebrals, and jugular. Right? Now, okay, so let's think about them. Vertebrals, where do they run their course?
From the back.
Yes, kind of from the back, but up through foramen magnum.
Foramen magnum,
And they're
yeah.
paired.
Right.
Right? And so, does it look like this structure that's I'm in the axial view? Is it something that's running inferior superior?
Sorry.
Right? Or no, it's going anterior posterior. So probably not like a vertebral, because vertebral comes up through that foramen magnum. Plus, I don't see foramen magnum, right? So probably not vertebral, right? Because that leaves us jugular or carotid. How are you going to tell the difference between like a jugular and carotid when this is the only plane that you have to work with? Think about where do we get the blood for the jugular?
From the sinuses.
From the sinuses. Specifically what sinuses?
The
Thinking like
sigmoids.
transverse, it comes down, sigmoids, and then into the jugular. The sigmoid sinus, right, is transversing what? What structure is it going around, running beside or next to, around?
The cerebellum.
Cerebellum.
Yeah.
What do we see here?
Cerebellum.
Cerebellum.
Uh-huh.
So, right,
Watch out.
if I'm on the back side of my petrous ridge,
Upload that.
posterior cranial fossa, I've got cerebellum. So therefore, the only thing that can be running through there has to be
For,
jugular, right? Because it's coming from that area, that posterior cranial fossa, and running basically transversely through the base of the skull. All right. So but let's think about the course of the carotid. Obviously, it must be different. So where does the carotid come up relative to the petrous ridge? Because it's a great landmark for you when you're looking at the head. And what does the internal carotid do? It comes up, all right, it kind of does this little turning thing, and then it pops up, like through the cavernous, like either side of the cell turcica type of thing, right? So it has to be basically anterior to the petrous, not posterior. So see, if you understand that, if you understand relationships of these structures to each other, you don't need 3D, right? You do 3D in your head, right? So that's how we would know that this is going to be jugular foramen, or you could say which side, left or right? Left.
Left.
Which type of jugular?
Internal.
Internal jugular vein, right?
Where's the carotid?
Yeah, so where's the carotid, right? So one thing we know is that the jugular, why is the jugular running, posterior or anteriorly through the base of the skull?
Did you say it's your left jugular?
Yeah, it's going to be the left internal jugular.
It's like,
Yeah, because feet are coming out at you. So how do I know, or why is the jugular doing that? Why not just go straight down? That seems like it'd be easier. How does the internal jugular run its course, like through the neck? Within a layer of fascia, the carotid sheath. So it needs to get close to the carotids, right?
Uh-huh.
And the carotids are anterior. So that's why it's running this way, so that when it comes out of the base of the skull, it's right where the carotids are, and they can run their course down the neck together. Okay? So, where would the carotids be, relatively speaking?
I was gonna ask.
Right? I'm going to have to
I was like,
I know that the carotids are going to have kind of a tortuous course through the base of the skull, and they're going to pop up somewhere around the sphenoid, right? Cella turcica area. So what would I have to do to find that? I'm going to have
Go
to go
lower.
up or down
Down. Oh,
to find where the internals are relative to the jugular. I could, now, if this was with contrast, I should probably see it here, but I could go down and find it like in the neck, like at the base of the skull. But because there's no contrast, it'd be very difficult to find that. So I'd probably have to come back up and
Back up.
find it running through the sphenoid, right? Through the, sphenoid, whatever you want to call it, in order to get kind of access to that. So it'd be harder to find that, but it is most likely, because this is all gray, there's no contrast. It's somewhere in this area right here is where the internals is coming up. All right. What is this? Besides bone. It's a bony process.
Is it a pterygoid?
Right? It's a pterygoid. Which one?
The medial.
Medial pterygoid.
Ha ha.
Right? That's the medial pterygoids. What does P-T-E-R-Y, pterio, what does that root word mean? Or prefix? Yeah, you think pterodactyl. Why was a pterodactyl called a pterodactyl? Because it had wings. It means winged.
Right.
So this is winged, is what it means. What it means. So they're a medial and a lateral winged. Right. So this would be lateral here. Right? There's lateral. Right. Okay. Oh, just started back at the top again. All right, we'll do that. All right. So what is what's that?
Foramen magnum. No?
Well, if it was foramen magnum, what goes through the foramen magnum?
All of the CN.
Well, CSF does flow through it, but what's running through the foramen magnum?
Your spinal cord.
And so spinal cord would have the same tissue as brain, so it should be gray like brain, right?
Gotcha.
So obviously, because I said that in the brain, CSF is black, it's probably CSF. So what is it then? CSF, where does CSF flow?
Oh, that's the cavernous sinus.
Where is the cavernous sinus in relation to other structures? Where do we see it?
On a cell
Cavernous sinus, we think either side of the cell turcica, sphenoid bone, right? So we should see what in front of it?
The
Anterior dye, you should see eyeballs, right?
Eyeballs.
You should see some nose, right? I see any of that stuff. Look at where you're at. No. Look
this
at
is
where
like
you're at.
the mandible region, no?
I see mandible
This
here. This is mandible. So this is maxilla.
Ah, it's maxilla.
This is base of skull. What is this? What is this?
foramen magnum.
That's foramen magnum.
Ah, okay.
I'm outside of the cranium. I'm not in the cranium. It can't be CSF. CSF doesn't flow outside the cranium. All right? It's your question. You can't just think, oh, black, cranium, CSF. All right? It's air.
Oh.
That's what.
It's not the trachea. What? We're not in the trachea yet. You can't call that trachea. Not esophagus yet either.
How can you
It's
have
the oropharynx.
I happen to know from my class, I apologize for interrupting.
You're fine.
Okay. You do not have to do the shadow health assignment for me tomorrow, the HENT.
Yes.
Thank you.
Thank you.
Don't worry, we'll make up for it.
Oh my god. Yeah.
Oh my gosh.
You'll be
It's good I didn't start it.
I got popcorn pizza. Moving on.
Orient yourself. Don't just like see color and think you know what it is, right? So that's the oropharynx there, right? So what is that?
Foramen magnum, right? Did you say?
Spinal
Well, the
cord.
foramen magnum is the hole there. Yeah, that's
CSF around the
okay,
spinal cord.
so yes, I can do this. That circle is around what? That's going through the foramen magnum. That is the spinal cord.
Spinal
right?
cord,
Spinal
yeah.
cord.
Yeah.
All right. So cool. We have identified the spinal cord. We know this is foramen magnum. That's wonderful. Now, what is that black line that it's going through? Now, I'm back inside the cranium, so it's possible that it is CSF, right?
What is subarachnoid space?
It could be subarachnoid space, right? Or it's either subarachnoid space or ventricle, right? So thinking about where you're at in the ventricle, okay, fourth ventricle, but fourth ventricle, I mean, it could be in that area. We know the fourth ventricle is kind of down there. And this is even, see here, last time I was able to kind of go one, like one. Yeah, so, all right, look here. All right, so there's that same line. All right, now notice, do you notice anything about like that line? And
There's,
it's kind of got,
it's got more.
it's kind of like a line that comes down and then it does what? Goes back towards that big black area back there in the back, which, what is that back here in the back? So what is this? What's that back there? That's the fourth ventricle, right? That's the most caudal portion of the fourth ventricle. So, that's CSF. We got it looks like a tube, a space, something connecting fourth ventricle and running down and around the spinal cord. So what is that? It's a pair. They seem to be kind of like
mesh.
lateral apertures. Right? That's how we get the CSF out of the fourth ventricle. Can you see the medial? No. Well, I can't say for sure. It should be right in that area, but I don't know. I can't.
What should be right there?
The median aperture, or Magendie, or Luschka. Yeah, Luschka Magendie is right there. Okay, so should be in that area. What about?
Did he move it or still?
Yeah, he went from here
Oh, okay.
To the dot.
To the flip.
So,
Peter, try to take it from this side because you're gonna confuse yourself. So the orientation is important.
You're right. What is it? Are you good? So it's more radiopaque than the brain tissue, so it's probably blood, right? Blood vessels, something like that. We know that there's a couple blood vessels that run through the foramen magnum. Now that I take that away, can you appreciate that there might be paired, that might be a paired structure? Yeah. Yes, so what is it?
Vertebral.
Very good. What is that? No, it can't be bacillary because that wouldn't be in the same plane. Look at it, appreciate the color, even though I know it's hard to see
That doesn't,
a lot of
that
color
doesn't
in
look
black
like
and white.
it's not a vessel.
Does it look like it's the same color as those two dots that we just looked at? No. Is it more or less radiopaque? More. So what's more radiopaque? With all the stuff that we've looked at in the cranium, what's going to be more radiopaque?
Bone.
Bone. So who is it? A little piece of bone right there, anterior side.
laryngeal tube. No.
No, style is on the side.
Sella, what are you doing? Sella and Christogali? No, Christogali is up here. The olfactory bulb right there, way at the anterior cranial fossa. No, but you're close.
That's the dens of C2.
That's the dens of C2.
What? Because I have a problem with it. That's probably why.
Sorry, that was dark.
What's it called?
Oh, there it is. Oh, you see. So that was just the very tip of it.
dens of C2.
Dens of C2.
What's it called?
Odontoid.
Oh, no, I understand now.
Yeah.
Yeah.
I never remember that one.
Dens of C2.
Damn.
All right, what about...
Alright, so we're up in the nose again. Ears. One of the ears.
Roughly where you're at in the, you said you see nose and ears, so in terms of like nasal cavity, kind of where are you? Are you like lower portion or upper portion?
Lower.
So you can see a lot more.
You can basically see all the nose. Yep, that's one thing. What else do you see that neighbors the nose? The concha, we can see that, right? And we see, the maxillary sinuses, right? So it kind of
the
gives you an idea
maxillary
of
sinus.
the lower nose, right? You don't see orbit. You can just barely see the very bottom of the orbit, the right orbit. So Yeah, so we're in the kind of the lower portion of the nose, right? So what bone does that make this right here then?
Sphenoid.
Sphenoid, okay? So we're thinking sphenoid bone. We've got this weird like hole in the sphenoid bone, right? Well, we already talked about some holes that run through the sphenoid bone, but we got holes. It's gonna be neurovascular. So what do we got?
So the color looks like it's like a brain, right?
Yeah, I mean it does look kind of like brain, but are we gonna have brain inside a bone?
That's what I was thinking.
Yeah,
It's like
I mean it is technically it's inside the brain, but not. We don't have brain inside the sphenoid bone,
Yeah.
right? Unless you have some type of teratoma.
right.
So.
I'm thinking like a sinus. It's the
Okay. Well, if it's a sinus, then
It should be black.
dural sinus,
Carotid
then it would be blood filled, right? So it should look like what we see back here, right? If it's a paranasal sinus, then it should be filled with air.
air.
So it doesn't really look like either one of those. So probably not a sinus
Is it blood?
of either type.
So,
Right? So think about what would be running through the sphenoid bone, right? We already saw, does the jugular run through the sphenoid bone?
No.
Right? It kind of runs to the bottom of that petrous ridge, kind of like, almost even kind of below, if you want to think about it that way, the sphenoid bone. Technically, it's still the sphenoid bone. But up here, this is kind of more on that anterior side, right? We know it is because we can see like this. What is that space right there?
The ear canal.
Right? So part of that auditory canal, right? And so here I am in the sphenoid bone. Look at what plane it's running in. What plane is that thing running in?
Axial.
The axial or the transverse plane, because I can see the whole thing. Right? What runs through the sphenoid bone that runs in the axial plane? The carotid canal. That's the carotid canal. This is much easier to see when you have contrast, obviously. But we know that the carotids come up, and do the carotid foramen do what? Turn anteriorly. Which way is that thing going? Anteriorly and medially, right? So that is the carotid canal, and you just happen to find a slice right through the middle of the carotid canal, right? And so it's going to turn and come up into, right here, it's going to turn and come up into the cavernous sinus, right, on either side. Okay. Okay. Can you see space there? Darker, CSF, right? So,
Frontal sinus.
what ventricle or whatever do we have that would have CSF in it that would be up that way?
Oh. CSF. Oh.
I'm at the level of the orbit, I'm right behind the eye. There's no ventricle up there. So where else is CSF found? It's made in the covert plexus, but that's within the ventricles. Once it leaves the ventricles, where does it go? Subarachnoid space, right? So anywhere that I see subarachnoid space, it would also be filled with CSF, so it should also appear the same color as CSF, right?
Right.
Kind of makes sense. So this is obviously has an area of subarachnoid space, but you see it's a little bit more granular, right? So why is that? Right? It's also got like some darker kind of dots in it. Look at where we're at, right behind the orbit. Right? You can even see, right, like, right, you can even see kind of, right in this area, right here. What is that?
sorry.
Oh, now you do it. Right? What is it? It'll come back on in a second. Oh, wait,
No, it turned off.
I know, it won't come back on in a second. So what would that be? Think like behind the orbit there was a hole that looked like it was connecting the eyes to that
canal.
area. That's the optic canal where the optic nerve would be going through. So think, all right, optic nerve is kind of coming, through the skull. So here was my eyes over here. I saw optic nerve going this way. What does optic nerve do? Comes in, Forms the optic chiasm, all right, bounces out around, the lateral oblique is angled here, okay? Where does that optic chiasm